Hello, and welcome to today's mini webinar on the Treat and Reduce Obesity Act of 2019. Your audio was muted when you joined the call. Questions can be submitted via the question box on your screen. The session will last approximately 15 minutes, including time for a Q&A after the presentation. This webinar will be recorded and available on the PWSA USA YouTube channel. Effective advocacy is essential to ensuring health, safety, and enhanced quality of life for those affected by Prader-Willi syndrome. As such, PWSA USA is committed to informing the PWS community of critical public policy issues and leveraging the power of grassroots supporters to enact change. Because Prader-Willi syndrome is considered a rare disease, extra effort is needed to raise awareness amongst the public and elected officials to guarantee the passage of legislation and regulations that help our community and defeat those that do not. I'm going to go through the next few slides quickly, but don't feel like you need to take any notes. After the webinar, you will be provided with a copy of this presentation, key talking points, and a recording of the webinar. First, we'll cover a little bit about the background of obesity in PWS, how obesity treatment is currently funded, and more about the Treat and Reduce Obesity Act of 2019, also known as TROA, and what you can do to advocate for the passage of this legislation. So let's get started. Prader-Willi syndrome is recognized as the most common genetic cause of life-threatening obesity in childhood. An unregulated appetite and easy weight gain begins between the ages of 3 and 8 years old, but are variable in onset and intensity. Individuals with PWS lack normal hunger and satiety cues. They are usually not able to control their food intake and will often overeat if not closely monitored. Food-seeking behaviors are also very common. In addition, the metabolic rate of persons with PWS is lower than normal. Left untreated, this combination of problems leads to morbid obesity and its many complications. For individuals with PWS, treating the insatiable appetite and obesity would represent a significant improvement in quality of life and the ability to live independently. Right now, there are two main ways that obesity is treated in the United States. The first is intensive behavioral therapy. Intensive behavioral therapy consists of measurements of body mass index, nutritional assessments, and intensive behavioral counseling that promotes sustained weight loss through high-intensity diet and exercise interventions. These interventions are an effective component in obesity management, which can result in healthy weight loss, improved glucose intolerance, blood pressure, and other physiological risk factors for cardiovascular disease. One of the barriers to effective obesity treatment in the U.S. is that the U.S. Centers for Medicare and Medicaid Services limits coverage for intensive behavioral therapy only to services that are provided by a primary care provider in a primary care setting. This narrow coverage decision prevents healthcare providers such as dietitians, who are better suited to effectively provide intensive behavioral therapy, from doing so. Additionally, when Congress enacted the Medicare prescription drug program, known as Medicare Part D, there were no widely accepted FDA-approved obesity therapies on the market. This fact, combined with the false perception by many on Capitol Hill that at the time that obesity was a lifestyle condition, led Congress to prevent Medicare Part D from covering weight loss drugs. Throughout the last 10 years, significant medical advances have been made in the development of obesity medications. That fact, combined with our country's current and growing obesity epidemic, clearly make the Part D statute out of date and out of touch with the current scientific evidence surrounding these new pharmaceutical treatments. For example, since Medicare Part D was passed, the FDA has approved a number of new obesity medications, and several other promising therapies are quickly progressing through the agency's approval process. So let's talk a little bit more about the bill itself. TROA is a bipartisan bill, as both Republicans and Democrats support it. Obesity itself is not a partisan issue because it can affect anyone. For those wondering, this bill is not part of the Affordable Care Act and is not affiliated with universal health care coverage. It simply means that those affected by PWS-related obesity will be afforded with the same rights and access to care as other recognized medical conditions. Better access to health care equals better living for all. If passed, this bill will amend Title XVIII of the Social Security Act to provide the coordination of programs to prevent and treat obesity. It will also provide the Centers for Medicare and Medicaid Services with the authority to expand the current Medicare benefit by allowing additional types of qualified healthcare providers to better serve their patients' needs by offering obesity treatment. This includes endocrinologists, behavioral therapists, nutritionists, just to name a few. It also gives the Medicare Part D program the authority to cover FDA-approved weight loss medications that complement obesity treatment. According to the Centers for Disease Control and Prevention, about 41% of adults age 60 and over had obesity in the period of 2015 through 2016, representing more than 27 million people in the USA. The National Institutes of Health has reported that obesity and overweight are now the second leading cause of death nationally, with an estimated 300,000 deaths a year attributed to obesity. Obesity increases the risk for other chronic diseases and conditions, including high blood pressure, heart disease, certain cancers, arthritis, mental illness, lipid disorders, sleep apnea, and type 2 diabetes. The rate of obesity among Medicare beneficiaries doubled from 1987 to 2002 and nearly doubled again by 2016, with Medicare spending on individuals with obesity during that time rising proportionally to reach about $50 billion in 2014. On average, a Medicare beneficiary with obesity costs around $2,018 in 2019 dollars, more than a healthy weight beneficiary. A study was conducted to assess the financial impact of Medicare coverage for excluded evidence-based obesity care, including lifestyle modification and counseling, as well as FDA-approved medications that treat obesity. The analysis used a microsimulation model to predict budget impact through the next 10 years. So let's take a look at that on the next slide. The study found that improving obesity care may improve health and may decrease the need for medication to treat obesity-related diseases. The analysis suggests that more Medicare beneficiaries use evidence-based obesity care services, the more that Medicare will save. Utilization of obesity treatments will generate Medicare budget savings between $18 to $23 billion over the next 10 years. The biggest savings are seen in the reduction of ambulatory care, Part D coverage, and prescription drug utilization, Part D. So let's talk a little bit more about the bills. In each sides of Congress, the House and the Senate, they operate separately as bills are introduced by individuals in each of the two chambers. The person or persons introducing the bills are called sponsors. Representatives introduce House bills designated by the letters HR for House Resolution, and senators introduce Senate bills designated by the letter S before the number of the bill. In the case of the Treat and Reduce Obesity Act, or TROA, the House and Senate have introduced companion bills, meaning representatives from the House and senators from the Senate introduced almost identical bills to maximize the chance of success of the bill passing. It's important to note that the bill in the House has 4 sponsors and the bill in the Senate has 2 sponsors. In both cases, at least one Democrat and one Republican in both chambers have co-sponsored the bill, so it is truly bipartisan. In addition to the original sponsors, representatives and senators can show their support for the bill in their chamber by becoming a co-sponsor. By doing so, legislators are demonstrating their support for TROA to their colleagues. We want more co-sponsors for this bill because the number of co-sponsors is one measure of the likelihood of a bill being passed when it is brought to a vote. Obesity is the most common cause of metabolic complications and poor quality of life for those affected by PWS. Hyperphagia, that not feeling satisfied after completing a meal, and obesity develop after an initial phase of poor feeding and failure to thrive. Hyperphagia in PWS patients can lead to early childhood obesity. By passing this bill, the PWS community will have access to cost-effective, coordinated, interdisciplinary care to address obesity in every state. Those affected by PWS-related obesity will be afforded the same rights and access to care as other recognized medical conditions. PWSA USA encourages state lawmakers to prioritize the treatment of obesity from a diverse range of healthcare providers and FDA-approved medications for chronic weight management. So now that you know more about obesity, its impact on individuals with PWS, and the TROA, let's talk a little bit more about how you can advocate for this bill's passage on behalf of the PWS community. First, you can send an email or physical mail. Your email or letter will be more effective if you address a single topic or issue rather than a variety of issues that you may feel passionate about. In this case, stick to the Treat and Reduce Obesity Act. A typed one-page letter is best. A physical letter is more likely to be read than an email. You can typically find an email or feedback web form and the mailing address on your elected official's website. Sending an email to an actual person is far better than using a website form. If you have trouble finding the best email or physical address, call the office and ask for me. I'll try and help you find it. Make sure your letter is legible and try to make it stand out by including pictures or bright colors to make sure it gets attention and leaves an impact. Don't do this if you're sending an email, though, as any attachments in your email may be caught in a spam filter, and then the staffer won't be able to open it. Keep your letter or your email brief, polite, and free of grammatical errors. You're probably wondering if social media really can be used for advocacy, and the answer is yes. Social media is a very public way to show your support or opposition for the policies or actions of your representatives. Not every elected official uses social media, but the ones that do are easily found by visiting their official websites. When posting, make sure that you tag their official page. Include a picture, as this increases the likelihood that others will read the text that goes along with it. Make it clear that you are a constituent of the elected official, and make sure the post is personalized. Be aware that any personal information that you post online could be visible to the rest of the public. You can also make a call to your elected official. It takes less than 5 minutes and is one of the most effective ways to advocate. Staff are dedicated to answering your phone calls, and every call matters. Phone calls require minimal time commitment and no traveling. Every elected official will have a public telephone number that constituents can call to leave feedback. This could either be a place where you leave a voicemail or talk to a staff member. You should only call your own elected officials and clearly state the address at which you are registered to vote so that they know you are a constituent. Clearly tell the staffer what you want the elected official to do. In this case, you want them to support the Treat and Reduce Obesity Act of 2019, why this issue is important to you, and why you feel motivated to call. Stay polite with the staffer on the phone, but be firm in your interaction, as it will be short. You can also attend a town hall. Attending a town hall meeting is a chance to meet with your representative and get updates on what they've been doing. They are usually held in a public setting and are free to attend. Town halls provide fantastic opportunities to gain face-to-face access to your elected official. To find out when town hall meetings will be held, monitor your elected official's website and social media pages, sign up for their email alerts, or call their office for event updates. In a typical town hall meeting, your elected official will speak for about 15 to 30 minutes about activities in Washington. Then they will open the floor to questions from constituents. Raise your hand immediately when they ask for questions. The longer you wait, the more competition you will have for the microphone. This is your opportunity to ask about an issue or piece of legislation. In this case, again, you want to talk about the Treat and Reduce Obesity Act. Make sure to have what you're going to say prepared in advance. You may only be given less than a minute to pose your question, so prepare a short summary of the bill or issue you are advocating for. Be sure to introduce yourself, state the bill number, title, and summary, and what position you are advocating for and why. Your summary and explainer should be no longer than 1 page. Again, only address one bill or issue at a time. If you aren't given a chance to ask your question during the meeting, stick around afterwards and find a staff member. They can take your comments, answer questions, and refer you to another staff member if needed. Bring a business card or type out a printed letter about your issue to help them follow up with you. Don't forget to network with other attendees while you're there, because it's a great way to get other people involved in the PWS community. You can also schedule a meeting to visit with your representative. Visiting your local district office takes some planning, but it makes the most impact. You'll have a chance to sit down with a staff member from your local district office, or maybe even get to talk to your elected official directly. In order to schedule a meeting, visit the website of the person you want to visit. You should be able to find a contact information for their scheduler or chief of staff, or you can find a section of their website called Request a Meeting. If there is a web form to request a meeting, fill it out and someone will get back to you. Most state elected officials have district offices that are near your home address. You can ask to meet at the official office, so there's less travel involved. If you're working with a larger group of PWS advocates, such as a chapter, you can advocate as a group. And it's a really great idea because the more people present at the meeting, the more amplified your message will be. Often when a large group is requesting a meeting, the elected official will meet at a local library or town hall or another local venue to accommodate your group size. You can expect to spend about 10 to 15 minutes with the elected official, and it's not uncommon for elected officials to have legislative assistants hold the meeting instead. While the elected official may only have a very limited amount of time during the meetings, their staff are in a better position to dedicate more time to hear your position and address your questions and concerns. As with the other ways to advocate, you'll want to introduce yourself and make a short statement about your position, your ask, a personal story, and why you came to meet with them. Be clear in what you are asking the person you are meeting with to do. Stick to one issue that you asked to discuss. If the conversation goes off topic, bring it back to the reason why you came, and don't be afraid to press a staffer or an elected official for a definitive answer or position statement in support of the Treat and Reduce Obesity Act. Ask if the elected official will pose for a photo with your group, and if everybody has given permission for the photo to be shared, share it all over your social media. You will want to thank the elected representative or their staff for meeting with you and supporting the PWS community as well. PWSA USA also has templates that you can use, and these boilerplate templates have some text that you can use and that you can customize. So we encourage you to personalize your emails, tweets, phone calls, and letters. These templates are more of a guide to help you make your point and use your own words to personalize your perspective. Thank you, everybody, for attending. If you have any questions, feel free to submit them via the question box on your screen. While you're typing out your questions, I want to remind everyone that PWSA USA is a 501c3 organization. So when you're meeting with your representatives on behalf of PWSA USA, keep in mind you're not lobbying, you're educating your legislators about issues that are important to you. This is so we don't jeopardize our tax-exempt status. I also want to take a moment to encourage everyone on here to register to vote, check your voter registration status, and turn up at the polls this November. When we talk to our elected officials, we want to be able to say that 100% of the PWS community votes. If you need help finding out about voter registration deadlines in your state, voting times, locations, whether or not you're even eligible to register to vote, please give me a call and I'll help you through the process. So with that, let's open it up for questions. It doesn't look like we have any questions. If you do have a question, you can always send it to me after this webinar ends. My email is alucy@pwsausa.org, or you can reach out to us at pwsausa.org, our website, or email our info@pwsausa.org email. Thank you, everybody, for attending, and I look forward to seeing you tomorrow on our next webinar.